I had the opportunity to visit our offices in Johannesburg, South Africa, back the last days of June. I'd like to give you some highlights of that visit. When I was in Johannesburg, I had the chance to cut a ribbon for the new canteen in the corporate headquarters. But more importantly, I had a chance to meet our employees in the region of EMEA, particularly Africa. I traveled with the Meta Region Management Team. Katarzyna's been with me, who is the CEO for the region EMEA. I learned a lot of things. It's a huge country with a lot of diversity and a lot of need for dialysis. There are patients that don't even know they're sick. So there's a lot of work for us to do. We have to find a way to partner with the governments in order to accomplish what it is that we want to do for these patients. Imagine a patient, 55 years old, who's a pharmacist, works every day, and he's been in center for 14 years, never once, ever, in the hospital. That's how compliant he is. That's the quality of care he gets in South Africa. Something for us to aspire to with all of our patients, to have that sort of experience. And as happy and motivated a gentleman as I've ever met. So I had the privilege to go to the Morningside Clinic in the hospital there, had a chance to meet with some incredible nephrologists, and also see a very young, very ill patient, a little boy named Nico, real trooper. He's hopeful that they'll be able to do some good for him. What also was very impressive is the fact that you see the pictures of patients, kids, that have been transplanted. And they put kidney bean jars around and they fill them up for each of these children that's been transplanted. It puts a name and a face together, and it really is meaningful to see what good work they're doing. I also cut a ribbon for our new learning and training center adjacent to one of our dialysis facilities in Johannesburg. So I had a chance to see the new facilities that are going to be used to train nurses that work for FMC, or they can be anybody that needs training. We're going to try to reach out and provide that training and leadership for them. I met Sydney. He was a hemo patient, quite a gregarious guy, had nothing but good things to say about the staff here, which always makes you feel good. And then I met Warren, who is a PD patient, and it's amazing the energy level that he has. He's home on peritoneal dialysis, and it works for him. It's what he wants to do. We walked next door to the Morningside Kidney Clinic, one of the most unique experiences I've ever had. So I met Martha. Martha actually is an employee of FMC. She's on dialysis with FMC, and she is on her way to a transplant. I can't wait to come back and see how she's doing when she's had her transplant. I can only imagine that in many of our other regions, and I will get to all the regions at some point, we have that same type of spirit and opportunity to help our patients. But South Africa was special for me, and I will be back. Thanks.